KFSR and CMAC present the Central Valley Ledger, a public affairs program featuring stories from all over the Central Valley with Sevag Tateosian, 90.7 KFSR.
Welcome to the Central Valley Ledger, a show highlighting community members that have a positive influence in the Valley. I'm your host, Sevag Tateosian. We are recording out of the beautiful downtown Fresno studios of the Community Media Access Collaborative in Fresno, Clovis, and we're broadcasting on 90.7 KFSR and CMAC's public channel. In this edition of the Central Valley Ledger, we'll be talking to Joe Prado, the Division Manager of the Community Health for the Department of Public Health in Fresno County, and Steve Mulligan, the District Manager for the Consolidated Mosquito Abatement District. Both of you, welcome to the program.
Excited to be here, Sevag.
Yep, thank you. Appreciate being invited.
So before we get into the topic of mosquitoes, I want to say for the record that I work for the Public Health Department as my day job, so
Yes,
I see Joe almost every day.
Yes.
Joe, nice to see you here in the studio.
Yeah, pleasure seeing you out here in a different context.
And Steve, I actually worked with you a few years ago when I was working in a different capacity. You actually came out and solved a mosquito problem that someone was having in one of your areas. So feels like home for me, with both of you here.
Right.
So let's start with you, Joe. Tell us about yourself.
Hi, well, Joe Prado. I've been with Fresno County for about 20 years, and I've worked everywhere from public health, behavioral health, our administrative office, public works and planning, and just really have enjoyed the opportunities the county has provided and really expanding that resume and really being able to help my community in just all sorts of different facets.
And you do a lot of things in the public health department, but especially in the community health division. We'll get into that a little later on.
Yeah.
Steve, tell us about yourself.
I'm District Manager of the Consolidated Mosquito Abatement District. The district is a special district in California, and our job is to survey and control mosquitoes and mosquito-borne diseases. I've been in mosquitoes for quite a while. I've been District Manager for about 26 years. Prior to that, I worked for the University of California Mosquito Research Lab as a researcher for 18 years.
Tell us a little bit about your district. It covers different areas. It's not just Fresno County, or is it?
Our district actually has a small portion of Kings County, about 18 square miles in Kings County, so we are a bi-county district. The total, the area of our district is 1,058 square miles. We incorporate 9 cities, including half of the city of Fresno. We share with another district.
Is all your territory having issues with mosquitoes right now? It's the time.
This is a mosquito season, and we have several mosquitoes, different species of mosquitoes that are important as nuisance and as public health issues.
Joe, talk about the tie-in of mosquitoes and public health.
Yeah, definitely. There's a significant tie-in, and I think that relationship has just been growing even more this coming year with the potential for Zika being in our valley. And so we really communicate heavily with Mosquito Abatement District on what type of cases we're seeing, the location of these cases, and then Mosquito Abatement Districts, they evaluate that and assess whether or not they're going to do any type of treatment or any intervention in the area.
I'm glad you brought up the different areas that you were talking about, locations of the mosquitoes. One of you, if I live somewhere in town, am I more likely to have mosquitoes than other parts of town? I mean, are we seeing more activity in certain areas?
Well, this is the mosquito season. You could have problems with mosquitoes no matter where you live. As long as there are sources of water that can produce mosquitoes, you can have mosquitoes. There's a variety of different species that we deal with. Some are more prevalent in some areas, but they're pretty widespread throughout Fresno County, throughout the Central Valley, throughout California.
When people hear mosquitoes, they all of a sudden get scared because, we're all being bit. I have mosquito bites on my foot right now, that hurt, but they're mosquito bites. When should we be concerned? Like, when should I worry that this mosquito bite may be something else? And I say that because I don't want to be paranoid, and I don't want to be like, oh my goodness, I got a bite, I got to go to the hospital, but I also want to understand that when it's significant, we should take care of it.
Yeah, you really want to assess, if you do have a mosquito bite, if you have a fever, you have a rash, you have joint pain for a pronounced amount of days, then you really want to communicate with your private care physician to see if there is anything else, and they'll do a workup and see whether or not there's any lab work that is necessary to rule out any of the diseases.
However, there's no cure for these diseases, the viruses. And so it's important that we don't want people to be afraid to go outside. We want people to, or overly concerned, but we do want people to be aware that there are certain things that they can do to protect themselves from mosquito bites by using insect repellents when they're outside in areas that have mosquitoes. They can also prevent the development of mosquitoes, reduce the number of mosquitoes by eliminating mosquito sources. That's a really important factor. And they can report mosquito problems to your local mosquito abatement district. We can go out to an area and try to find out if there's a source of mosquito production that we are missing. Get out there to try to control it. But it's key to eliminate sources around your individual premises.
Water. Let's talk about water a little bit. When I go back in the backyard and I water, I have some grapevines, I have a pomegranate tree. When I water those, am I creating a safe haven for mosquitoes?
It depends on the length of time that water stands. And if the water, depending on the species of mosquitoes, if the water stands for a week or longer, you can be producing mosquitoes. And we see that in some agricultural crops. If there's over-irrigation, ponding of water, they can produce mosquitoes. In residential areas, of course, just the presence of water in small containers around a house. Unmaintained swimming pools are a huge problem, a source of production for thousands upon thousands of mosquitoes in a neighborhood from just a single unmaintained swimming pool.
Joe, talk a little bit about, do we still have Zika? I mean, I know that last year it was a big issue. Is it still around?
Yeah, we're still seeing Zika cases. We're still seeing travel-associated Zika cases. So there hasn't been any local transmission here in Fresno County yet. But that is really, as of last year, working with the mosquito abatement districts, really increased the amount of surveillance and the communication with mosquito abatement. So we want to, the districts are really taking an aggressive approach and really trying to prevent the population from really growing here in this area.
It sounds like you have a great partnership together. How important is that partnership? And health department, do you have partnerships like this with a lot of agencies?
Yeah, I think, when you hear the term public health, it's so broad, right? And it's like, what do they do? Well, it's important. We can't do our job well if we don't have all these collaborations. And with mosquito abatement, it was really sitting down with them and talking about what they needed from us. And they had a list of things they needed us to do more of. And we've just been improving that process over the past year and really getting ready for this potential season coming up.
Steve, I want to ask you about West Nile. Years ago, there was a big scare about West Nile. It kind of died off, but every year we heard a little bit about cases. Now, you're in the business, so you probably heard more than we did from the media. Recently, there was West Nile detected somewhere in the area.
Right. West Nile is endemic in the United States and California. We have human cases of West Nile every year now. We have in California since 2003. I think there's been, in California, over 6,000 human infections from 2003 to 2016. About maybe 3,400 of those were severe neurologic symptoms, and I think there's been about 247 fatalities in California.
So it can actually kill you.
Yeah, it's a very serious disease, can be a very serious disease. Most people, if they are infected with West Nile, they won't develop symptoms. Only about 20% of the people that are bitten by an infected mosquito will show symptoms, and about 1 in maybe 120 can experience severe neurological symptoms, and which can lead to long-term disability or death.
I mean, we get the idea of how viruses are transmitted, but can you be a little bit more specific as to how, I mean, so a mosquito just bites you and all of a sudden you've got West Nile? I mean, talk about the transmission process a little bit, because I think the average person in the public may not know, and I don't even know.
It varies from disease to disease, and you mentioning West Nile virus. West Nile virus is a disease of birds. It infects birds, and they're infected by the bite of a mosquito. So an infected bird is bitten by a mosquito, infects a mosquito, and then it takes a while for that infection to develop in the mosquito. It takes a week or longer, and during that time the virus travels up to the salivary glands and creates an infection. And during that time, the female, when it bites the infected bird, gets the blood. And it's only female mosquitoes that bite.
Oh, so I'm going to stop you there. Okay. So the male mosquitoes are not the biters.
Male mosquitoes cannot bite. Male mosquitoes cannot spread infection. Their only job is to mate with the female.
Interesting. Mm-hmm. So when I'm in my backyard and I'm watering the lawn or playing with my kids and I see a mosquito bite on me or my kids, I shouldn't panic?
No, you should not panic. What we want to do is just make people aware that if you notice mosquitoes, there are ways to prevent mosquito bites. You can wear, when you're outside, you can wear long sleeve shirts, long pants, loose fitting, that prevent the mosquitoes from landing on your skin. You can use, and you should be using, insect repellents, and there's a variety of different ingredients that work well, and also a variety of different formulations. So you should be using insect repellents to prevent mosquito bites, and just eliminate sources too.
Some people say they don't use mosquito repellent because there's toxins in there. What do you say about that?
Well, they've all been approved for human consumption and use. So that is something that, as people read the labels and they can do their research on what exactly some side effects that they may have, but they are safe for use.
There was a new virus that someone talked about a few weeks ago. I can't say the name, so I'm not even going to try. But it was something that the public health department was involved in. Steve, you might know about it.
It's an old virus. It's been around. It's been around in the United States for years. We've had cases of that. It's St. Louis encephalitis. It's another virus that's spread by mosquitoes. It's been around for decades. We've had fewer cases of that in recent years, and particularly with the advent of West Nile virus. But that's another mosquito-borne virus. Again, it's a disease of birds transmitted by mosquitoes. And if a mosquito becomes infected by biting a bird that has that can, once it becomes infected, if it bites a human, it can transmit that virus to the human, and we can be infected as an incidental host. We cannot really amplify the virus to infect another mosquito, but we can be infected.
And when we get infected, it sounds like it's horrible.
Again, with most of these, it's only a certain percentage of the individuals that are bitten that will show symptoms. And generally, for most diseases, Joe, it's about mosquito-borne disease for St. Louis, West Nile, it's about 20% that show.
Right.
Maybe you can describe the neurological symptoms and.
Yeah, well, you're going to see fever, rash, joint pain, and a lot of these mosquito-borne illnesses. And so, once you do get bitten, it's not, oh my goodness, it's really, okay, do I feel any of these symptoms? And if I am for a day or two, 3, then let's then go to your doctor and really find out what exactly it is.
Walk us through the process, one of you, about you go out, how do you know which neighborhoods to test? This is going to be a multiple question. So
yeah.
You go out, how do you know which neighborhood to test? You test, and all of a sudden you found Zika. Now what?
So I'll start on my end, and then Steve, you can carry on your side. So pretty much if you go to your physician, they're going to order a laboratory work to be done on you. we are made aware that that is a mandatory report to us. So we are actually notified at the health department. We then will contact you. So you will get a friendly phone call from the public health department and obtain some additional information. Did you travel? When exactly were you feeling these symptoms? We're trying to identify the viremic period, so the incubation period, to see whether or not there is an issue there. As we gain all this information, we want to know where you work. So even though maybe it's not around your home, maybe it's where you actually work. We take that information and we communicate that over to the mosquito abatement districts, pretty much live. Once we obtain the information, we have a live setting arrangement to communicate with mosquito, and then they take it from there.
Mm-hmm. And we would like, and we would go out to those areas, the residents, collect mosquitoes, send those mosquitoes into the laboratory. It's a University of California laboratory that checks for those viruses to determine whether those mosquitoes have the virus and can be transmitting it. But we also take some steps to preempt that. We want to prevent. That's in the case. What Joe mentioned is in the case of we have somebody with symptoms and potential disease, a suspect case or an actual confirmed case. We want to preempt that and try to find out ahead of time if the mosquitoes in the area are infective. So we will go out throughout our district. As part of our program, we do surveillance, routine surveillance. We set out traps to collect adult mosquitoes. We do that to determine the abundance of the mosquitoes, the type of mosquitoes that are present, including whether they can vector disease. And then we can take samples of the female mosquitoes, send them into the laboratory to have them tested to see if they're infected with the diseases, and then we can notify the public at that time that there's a chance or a risk for mosquito-borne disease infection.
It could be that the mosquito hasn't bit anybody, but it could be that the mosquito has bit several people. So how then, I mean, then it's just a media campaign, it sounds like, to get people to be more alert?
Right, and so that's part of our funding sources that we have, and the state's made available this year, is that there is an outreach campaign here. And so we, at Public Health, we have our own set of outreach campaign. Our focus is with a vulnerable population, pregnant women, and how it relates to Zika, but also the general population. And so we're actually working with the mosquito abatement districts to send them additional funding for an additional outreach campaign.
You know, it's sad that mosquitoes bite and it triggers this whole process, but to me, I love the process. I mean, you get a doctor, reports it, health department then contacts the person, gets involved, researches, and then passes it on to mosquito abatement. What a team, right?
It's, yeah, and we really appreciate the cooperation, the collaboration we have with the county health department. It allows us to be a step ahead so we can go out to these areas and try to prevent any additional infections, eliminate the mosquito risk. And so we would respond in these areas where we have suspect or confirmed mosquito-borne disease cases in humans, or even where we collect mosquitoes. We can do applications of insecticides to control adult mosquitoes in those areas to try to reduce the risk.
You're saying standing water, and right away I'm thinking rivers. We have some beautiful rivers in this area. We have some beautiful homes sitting on beautiful lakes in this area. Should those people be more on alert, or have you placed some sort of mosquito-eating fish or something in there?
Well, again, it's important for everybody anywhere to be aware of the threat of mosquito-borne disease and take preventative measures. Along the rivers, in fast-moving water, rivers and ditches, and it's not sheltered or protected by vegetation, mosquitoes will not survive. However, if where they have subbing of the waters along the rivers, right now we've had some really bad flooding along the rivers, particularly the Kings River, flooded out a lot of areas which have led to ponding of standing water in some of those areas. We have our crews out there actually checking those for the presence of immature mosquitoes and treating them with insecticides that will kill the mosquito larvae, the immatures in the water.
So if I'm living on like Lake Van Ness or Woodward Lake, how can I be proactive in this fight? Can I come to you and say, all right, Steve, let's partner up, although there's no, and I don't want to cast a net and say that there's mosquitoes there because I don't know the answer. But I'm saying anybody that lives on, and even Quail Lake, and I say those because I love the houses on the lake. So if I'm living on a house on a lake and I want to be proactive, I come to you and say what?
Well, we would let you know that those areas where they have those lakes or the pond, we know about those. We've been checking those, and they have been stocked with mosquito-eating fish, and they're doing a good job containing that. The banks are pretty well manicured. They're not a mosquito production problem. They're being maintained, treated when necessary. However, it's your house that's the problem. Go around your home and let your neighbors know as well. Go around your home, look for little sources of water, any dishes, pots. The dish underneath a flower pot that collects that water, that can produce mosquitoes. A disused pan that you have sitting out that's collecting nuisance water from your sprinkler system, that can produce mosquitoes. So clear up your area. If you have animal watering dishes, you should be emptying those, rinsing them out, washing them out, adding new fresh water to that dish a couple times a week. It'll prevent any mosquito production, and it will give your pet fresh water.
That's what I was going to go next, is for people who have dogs and cats. Obviously, we're not going to put mosquito-eating fish in those in that water, but so every week, couple of times?
Yeah, Sevag, dump and drain. Dump any containers, get rid of any unnecessary containers, toss them out. Containers that you need, dump them, drain them at least once a week, and fill them with fresh water.
Joe, let me talk to you a little bit about the health or the community health division of the health department. Do people know what you do? Like when you go out there at a party and you're mingling and you say, "Oh, I'm the division manager of the community health division."
Right.
Sounds great. I mean,
community health is everything, right? And just yesterday I was at the Council of Governments. I sit on the round table there, and it was discussion about public health and what we do in our division. And I call us the hodgepodge of the department. We have our tuberculosis clinic, immunization clinic, HIV, STD programs, epidemiology, public health laboratory, public health emergency preparedness, medical marijuana ID card. So it really is all, if it doesn't fit anywhere else, it comes into this division. But the beauty of this division, though, is that we work together so much. So whether it's a childhood lead poisoning program, whether there's a TB issue, a meningitis case, we all come together quickly to investigate and address our community needs. And at times it's not big enough. Our division is 85 employees and we have a $10 million budget. It exceeds that, and so we're asking for assistance from our nurses from the public health nursing division, sometimes from other environmental health, and so we've had some situations where that's actually occurred.
Steve, I want to go to you because I wanted to ask you a question earlier that I forgot to ask, so I'm going to ask you now. I don't mean to keep jumping, jumping different topics. You've been doing this for so long. Do you still say wow when a test comes back and the mosquito has Zika or something else? Does that still, like, if it was me and I was in your shoes, granted I haven't done this much, and I see something come back with Zika, I'm jumping up and down, waving a red flag, telling people, oh my gosh, Zika, Zika, Zika. In your role, what happens when you see a mosquito and it's infected?
Sevag, that's a good question. I mean, our response is we need to do something about it, do what we can to prevent that mosquito from biting and infecting people. So we'll do everything that we can to do that. It's important that we get the word out, and that's where the cooperation with the Fresno County Health Department comes in, to get that information out to the media so that the people can hear about it and take action. But I've been in the business for a long time. I'm continually learning new things, and also things change. And just recently in 2013, California and the city of Clovis and city of Madera was invaded with a new mosquito to California. It's the Aedes aegypti mosquito, the yellow fever mosquito, and this is a tropical subtropical mosquito found in humid areas of the world. It shouldn't be coming to the arid Fresno, Central Valley. However, we found it here. It's become established. This is a mosquito that can transmit some extremely serious diseases, including dengue hemorrhagic fever, chikungunya, Zika virus, and historically yellow fever.
Wow.
So these are something new. Okay, why now? Why is it here?
How did it get
and how
here?
can we and what can we do to fight it? Because this is a mosquito that loves humans. It thrives in the environment that we produce. We produce these small containers where the female lays her eggs and they develop. Also, it prefers to bite humans. I mentioned the other diseases. They're diseases of birds that are transmitted by mosquitoes. Zika, dengue, yellow fever, those are viruses of people, primates, that are transmitted by the disease, by the mosquito.
We are running out of time, but I'm sure, it's all great information. I could talk to you two for probably another 2 hours, but we'll save that for another time. Do you ever get the question, and I always wonder, how these mosquitoes get here? Like, fine, this new mosquito that you said, which I don't know how to say the name, is a tropical mosquito. What's it doing in Fresno?
Well, that's a good question, and why now? It actually, we are seeing these mosquitoes, different species that are invading new areas, spreading out. We see the emergence of new diseases like, Zika virus that's spreading out. It's because of transport of goods, transportation of people, and I think possibly it has effects of climate change and the way that we modify the environment around us.
We are out of time. Any final thoughts briefly?
Just with the new mosquito that's here, it really has brought us together even more so. Even the collaboration has gotten stronger. And so as our community sees these different things, and they're scary because they're new, but it really forces us to come together a lot more and really be able to respond.
I love it. And on that note, I'm going to have to cut you off because we're out of time. That is it for this edition of the Central Valley Ledger. You can watch more episodes of the Central Valley Ledger on CMAX channels, Xfinity 93, UVerse 99, or on CMAX website, www.cmac.tv. You can listen to episodes of the Central Valley Ledger on 90.7 FM KFSR Fresno. Thank you to the volunteer crew that made this production possible. They're in the studios now making us look and sound good. To become a volunteer, visit CMAX website and click on the membership tab. Thanks to our guests, Joe Prado and Steve Mulligan. And thank you for joining us. We'll see you next week on a new edition.
KFSR and CMAC present the Central Valley Ledger every Sunday morning at 11:30. For a complete program schedule, visit kfsr.org.